discussing substance use, suicidal ideation rather, and attempt in youth. Suicidal ideation and attempt in youth. I will be discussing all of this with Dr. Olusegun Shoyombo. I got that right, I hope.
Almost.
I need my mental health checked. That's Dr. Olusegun Shoyombo. Okay, that's the first time I'm actually getting to say that name out. But thank you so much for being part of the program.
Thank you for having me.
Yes, Dr. Shoyombo is a consultant psychiatrist with the National Hospital Abuja. So thanks for being on ASO Morning. We're talking about mental health in Nigeria. We're talking about the suicide rate. We're talking about youth substance abuse. It's an encompassing topic. Now, sadly, we don't have statistics. We don't have data that you can say, okay, XYZ number of people have lost their lives, maybe because of our cultural values or our cultural norm, but indeed, mental health, substance abuse, suicidal thoughts are realities of current day situation. But we don't know how to. I was actually looking at research, and I found out that Nigeria does have a very high index of suicidal thoughts and suicide rates, but we brush it under the carpet. So let's start with that. What can get someone to have those kind of suicidal thoughts? Is it the abuse of substance? What is the correlation with all of it?
Thank you very much. I think that before we get into what can drive people to suicide, let us address the numbers, as you have said at the beginning. We do have numbers, we have statistics. We can question how accurate it is. And then all over the world, really, you would question the accuracy of suicide figures. This is an event that is highly stigmatized, underreported. So you won't be surprised if you do not have very accurate figures. Worldwide, about 800,000 people take their lives annually. In our country, I may not be able to give you and say this is a specific figure, but there have been pockets of studies that have looked at, maybe some people will go and look at police figures, but you see that's only for cases that got reported to the police. Some people will look at the media. That's only for cases that made it into the headlines, you understand? So you see that whichever way you look, you are likely to have a figure that is an underestimate of actual figures. But the reality is that it is here with us. Years back, we used to think it was an Oyibo problem. Black people don't kill themselves. But in recent times, we have seen that it is here with us. Is it on the increase? There are arguments for and against. One argument is that no, we only have better number reporting. Now we've got social media. Before it happens, it's gone viral and all that, and that tends to give people the idea that, oh, it's increasing. But whether or not it is increasing, it is a tragedy that shouldn't be happening. It is something that we should be preventing. Now to your question, what drives people to the point of suicide? Again, we must first establish that this is an act of self-harm with the intention to take one's life. The person who does it actually intends to complete it, okay? And there are many factors. One of them would be having a mental illness, usually depression. When depression gets severe, it can lead to a point where a person feels hopeless, worthless, and sees no point in being alive, and then begins to think of taking their own lives. You also mentioned substance abuse, which is also a form of mental health condition. So when people abuse substances, they can get to the point of despair, where they get hopeless when they've lost control completely to the substance. You know that when people are under the influence of psychoactive substances, it can also impair their judgment. So their decision making may not be as on point as it should be, and then they can take wrong steps. But not all suicides are related to existing mental illnesses. Some of them are quite impulsive, spur of the moment action. Somebody gets into a very difficult situation in business, in relationship, a serious medical diagnosis, anything at all that the person's mind interprets as their world crashing down on them, and then they tend to resort to that. Finally, final point I want to make on this, as you said, it's a growing trend in Nigeria. That is not surprising, because the vast majority of suicides across the world occur in low and middle income countries.
Yes.
We are a low, well, some will say middle income country.
Yes.
Okay. You also look at our population, because when people report statistics, they should put it in context. You will see people who say, oh, Nigeria is the epicenter of suicide. Why? Because they are reporting raw figures. But we are 200 million people. Whatever percentage of 200 million you take is a big,
Exactly.
I get the point
number
now, yes.
and all that. You see, so we are in that demography where you begin to have these things. Yes.
Stigmatization. That's the major, when you talk about mental health, stigmatization. Like you said, people think it's a foreign man's disease. I don't even know how many psychiatric homes or, people you can actually walk in, like how you have malaria and say, okay, I want to go see a doctor. That someone can say, okay, I want to go talk to someone. I'm having issues. I can't cope with this. We don't have enough awareness for the need to have that mental health analysis or mental health conversations with people like you. Is it based on our culture? Is it based on the fact that people will feel stigmatized, I'm not strong enough, or you're a weakling, that, and especially men, because women, I think we're our own consultants. We talk to ourselves more, we cry easily, we can vent. But I don't think the Nigerian man has that opportunity or privilege. So how do we, what's the right question now? Why aren't we aware that mental health issue is as severe as maybe malaria or worse?
Again, I'll thank you for making this time out to talk about this, giving a platform to discuss this. You are solving the problem. You've already identified that there's a lack of awareness, and then you have this discussion on television. You're already creating awareness. Is it enough? Absolutely not. We should do a lot more. One of the reasons why we don't talk about it is that it's a hush-hush topic. But again, we are doing better. Things are better than they used to be. When you talk about stigma, think of our environment, for example. People want to get married. They say, go and investigate that family. What are they investigating? Mental illness, suicide, epilepsy. And then somebody will say, don't marry from that family. You understand? That's the stigma surrounding it. Therefore, if it happens in that family, either of these, any of these things that I've spoken about, the tendency is for them to cover it up, because they don't want other people to know, so that they don't suffer the stigma of it later. But stigma prevents people from accessing
Medical
care.
health.
Stigma makes people suffer unnecessarily. There's something we call the treatment gap, the mental health treatment gap, and it simply refers to people who need help who do not have access to help, and it is in the range of 50 to 85%.
Of the population?
In our environment.
Oh, wow.
That if you have 10 people who need mental health services, about 8 of them will not have ready access or early access as at when
needed.
And let's not get despondent. Even in the advanced world, the mental health gap is up to 50%. You understand? That's not to comfort us in a wrong way.
I was just going to say that. I was just going to say that's very comforting.
Not to comfort, but just to set, just to put things in perspective. So you see, that treatment gap is there. So there are psychiatric hospitals, there are general hospitals. A lot of people don't like to go to psychiatric hospitals. But before I even come to that, let us first establish that mental illness is an illness like any other condition. It is a medical condition. It is not your village people. And if your village people are troubling you, you can come to my village. We are nice people. It's not a spiritual problem. Are we saying don't pray about it? Absolutely not. If you have an accident and break a leg, you will pray. So if you have a mental illness, pray, but by all means, let us do the treatment. Let's give the necessary intervention. So these things happen. The way somebody can have hypertension, diabetes, somebody can also have a mental health condition, and treatment is available. I do not think that there is any state in this federation as of today where somebody cannot access mental health services?
Most people don't know where it is. I don't know for one, and I'm a broadcaster, and I know we know a lot of things.
So let me help you and help
Please,
us.
for Abuja, if people really want to talk to someone and they think they have a mental problem, mental health issue, where should they go?
National Hospital Abuja has a department of psychiatry.
Okay.
The FCT has a hospital in Karo called Behavioral Hospital within the General Hospital Complex in Karo. That is largely a mental health service.
Okay.
University of Abuja Teaching Hospital Gwagwalada has a department of psychiatry. The Federal Medical Center in Jabi, they have a department of psychiatry. That's 4 government hospitals within Abuja.
Yes.
There are several private. Across the country, there used to be 8 federal neuropsychiatric hospitals, now 9, because there's one that has just been established in Kwara State. Before then, we had Yaba. Everybody knows Yaba left.
Yaba, like mad people go there. That's where we grew up.
We have Aro in Abeokuta.
Yes.
We have New Heaven in Enugu. We have Kware in Sokoto. We have Meduguri. We have Uselu in Benin. We have Calabar.
123 Calabar Road. That's how we call it. If you're acting funny, they say we'll take you to 123 Calabar Road. That's
and then
the
we
address.
have Banawa in Kaduna. Now, apart from these hospitals established strictly for the purpose of providing mental health services, there is no teaching hospital that doesn't have a department of psychiatry. Because to get accreditation to be of a teaching hospital status, you must provide mental health services.
Oh, wow.
There is no doctor who qualifies from medical school without going through training in psychiatry. So name it, all your teaching hospitals, and in any state of this federation, you would at least have either a federal government university teaching hospital or a state university teaching hospital. Some states have 2 or more of such centers. Now, the challenge is that these services are still largely concentrated in urban centers.
Right.
So we still have lack of access for people in rural areas. But just to respond to that question of where are these services? Yes.
Well, mental health isn't like malaria that you have a headache. You just start having certain thoughts. But give us an idea as to how it begins. One that is not substance induced or related. So just give us an idea as to when to start getting worried. Because the other day I was telling you, Funaya, that for some reason I just get anxious. I should probably see a counselor and all of that. But when should one start get worried?
Well, again, this is a huge question, because when you talk about mental illnesses, it's like saying febrile illnesses. Are we talking about malaria, typhoid? Are we talking about meningitis? Are we talking about... So mental health is a very big umbrella of illnesses. The symptoms will not be the same. But I'll try and keep it simple and speak in as general a term as possible. But if we're talking about suicide, we'll be talking about depression side by side. When should people begin to suspect that they may be having a depressive illness? So depression is characterized by 3 main symptoms. A low mood that is protracted. Remember, we all get sad from time to time.
Absolutely.
If there is a reason, I don't have money, my candidate did not win election, my team lost a football match, you get sad. But usually that will be a transient thing, and then you recover from it and you move on. But when people experience low mood that is persistent for some period, when you have loss of interest in activities you previously enjoyed. So I stop hanging out, I stop reading, I stop watching TV, I stop singing. The things I used to enjoy doing, I no longer do them. Or even when I do them, I no longer derive pleasure from them. And then there's decreased energy. You just feel like there is no energy to do anything. And I always say to people, depression is not laziness. So when you see somebody who has been up and about suddenly seem to have a dip, you know, stops coming to work or comes late, can't turn in his assignments and things like that, you should wonder if the person is okay psychologically. So to summarize those, low mood, low energy, loss of interest in pleasurable activities. Before you have associated symptoms like poor appetite, or in some cases, increased appetite. Some people, when they're in a bad mood, take solace in food. Poor concentration, poor sleep, things like that. And then as it gets more severe, you will have those negative self-evaluation, hopelessness, worthlessness, and then the thoughts of self-harm. You see very strange symptoms, like people who look at an obituary notice and envy the person. Oh, how I wish that was me.
Whoa, yeah, there are people who do that.
Anything I tell you, I'm telling you because I've experienced it in my interactions with patients. So that's how deep
that people actually wish
these things can be.
They actually do it.
Yeah. So about other symptoms that people may have for other mental illnesses, there might be strange experiences. If anybody hears voices that you think other people do not hear, or you see things that you think other people do not see, for some people they feel very, very unsafe. They feel like people want to harm them, or people are monitoring them. They may feel like there are cameras installed in their rooms. They may feel like people have bugged their phones, and they are not telling lies. That is the reality. They believe it very strongly, except that when we look all around them, we cannot find any basis for those
that thought.
beliefs. And you have mentioned anxiety. Anxiety is a normal part of life. Anxiety is what makes us survive. Anxiety is the reason why when you entered university you could not read, but when they published exam timetable, suddenly the book started entering your head. Yeah. However, anxiety can become crippling. It can get to an extent where it interferes with our ability to function or to enjoy everyday life. So when people feel anxious, feel on edge all the time, they may also need to see a psychiatrist.
But what's interesting is some of the suicides we read about are people who seemingly were happy. They were cheerful, they were happy until one day just seems like they write a note and kill themselves, really. So in such instances, what would you say for people who probably lived beside this really happy-go-lucky looking people?
Thank you for bringing us back on track to discuss suicide. Okay, so many people may not appear the way they feel. So we should be careful, okay? Because like you said, especially those ones who make it into the news, they seem to be doing well. I mean, a comedian, unfortunately, died through that means. And up until the time he died, he was doing comedy and making people laugh and all that. So there are things to look out for. Usually, there would have been warning signs. Usually, the person would have cried for help.
Wow.
The person may have posted some negative things on social media or made certain negative comments. Sometimes these negative comments are masked in religiosity, vanity upon vanity. All is vanity. And you think, oh, this person is just quoting scripture. The person might have deep-seated depressive symptoms. Another thing we should not take for granted is an expression of a desire to kill oneself. Some people say it so often that people begin to dismiss it. Usually, people who do it would have been saying, this life is it not better for one to just go? Is life worth living? Sometimes there are some preparations made. They begin to dash out items, apologize to you if I've offended you, please forgive me, and things like that. So they make those active preparations. Sometimes it will be irritable mood. They get angry, fight people and all that, and that is a pointer that all is not well with this person. But you see, all of these discussions center around people who have been struggling. Remember, we said there are some people who take their lives impulsively. Even they did not think about it that morning. But they go to their bank and somebody has wiped all their money clean. Yeah. And at that time, they have a catastrophic reaction that life is not worth living.
Okay, so I would like to just ask if there is intermittently, should one just go get mental evaluation, whether or not you have obvious some of what you have mentioned?
Well, the first thing if I ask you to get intermittent mental health evaluation is whether I myself can cope with the demand,
with the number,
or if I don't mind the pressure, how much money will I make if people come to me? But that's just on the side. I don't think there's anything like routine mental health evaluation. I think the focus should be more on us creating public awareness so that people know when to seek help. Number two is that people should not wait until they can identify a psychiatrist or a hospital with psychiatric services. Please approach any doctor. The doctor will be able to point you in the right direction. Okay, and then we must pay attention to preventive measures. What can we do as a people? What can the government do? What can we do in ASO TV as an institution? What can I do in my personal capacity as a psychiatrist, in your capacity as a broadcaster? We all have roles to play. As broadcasters, for example, there is what we call responsible reportage of suicide. There are details you do not bring on TV. And that's why some of us are a bit worried about the lack of censorship you find on social media.
Yes.
Regulated media like this, there are components of it, because you want to avoid what we call copycat events. You see that when you have any event that makes headlines, you will have
People who want to do the same thing.
That's because of irresponsible reportage. People have spread the news in an irresponsible way, including unnecessary details. If you watch the news these days, they don't even report that celebrities died by
a certain
method, or that to even attribute it to suicide. They will just say so person has died at the age of this. It is much later that they can say that the corona has ruled it death by suicide, and they will not go into the details. They will not mention the method, they will not mention the circumstances and things like that. That is to prevent copycat events. So just to say, the media also have a very deep role to play.
Let's talk about the criminality of suicide. It's still a crime in Nigeria if you feel, I don't know what that, it doesn't make sense to me. Because if someone tries to commit suicide and then the person does feel, you'll be arrested and then there's a jail sentence for it. From my own layman's point of view, I know that anybody that had tried suicide is in a mental state. He's depressed. There's a lot of things he's doing with. And then I think criminalizing it also makes it worse for the person. So what are you doctors doing towards, is it working with the police to ensure that this doesn't become a criminal issue, but something that...
mental intervention.
More like a medical intervention.
So before January of this year, the only law regulating mental health practice and provision in Nigeria was what we call the Lunacy Act of 1958.
Yes, 58.
And yes, in that act, suicide was a criminal offense, that a person could be sent to jail for. But former President Buhari signed a new mental health bill into law in January of this year. Unfortunately, I'm not very abreast with that section on suicide, but I know very well that part of the amendments that we sought for, that was one of the very important reasons that we wanted a new mental health law passed. I would be surprised if that has been retained. I can almost bet, and I'm only saying this because it's not something I've looked at, but if I were to hazard a guess, I can almost bet that that has been expunged from the new mental health law, and I can check that and get back to you on it.
So let's talk about substance abuse, because we're trying to find a correlation. Statistics have shown, or some people may argue that because we have more information now, but there has been an increase in substance abuse in the youth, not necessarily any gender. We've seen female abusing substances as hard as men and vice versa. And of course, we know the general drugs are not good for you, stay away from that. But what's the correlation with mental health? Can hallucinations or things like that, can those substances induce or promote or encourage, mental illnesses, depression, suicidal thoughts?
So, addiction itself is a mental illness. A person can a person can start abusing substances like a form of recreation, but very quickly, usually, the use escalates. So what I like to say that at the beginning, it is the person using the drug. In the later stages, it is the drug using the person. So it's a mental illness on its own. Some substances, and a lot of them, can have direct impact on a person's mental health. In other words, can lead to symptoms like hallucinations that you have spoken about. Like the very whitewashed cannabis. It's a hallucinogen. It can make somebody hallucinate. And when we were growing up, it was a motor park drug.
Drug, yes.
But now
But
it's
they've whitewashed it now. You wear suit and wear very fine dress, and then you feel cool with it. But it's a very dangerous drug. It's a drug that is directly linked with an illness called schizophrenia. The relationship between cannabis and schizophrenia is almost as close as the relationship between cigarette smoking and lung cancer. We are just this close to saying this causes that. You understand? Yeah. And then other drugs too. You hear of Mary that they are abusing.
Yes.
Elsewhere. People dry up, and then people have severe mental illnesses, and then people die from those drugs. Also, you see, these drugs, they impair a person's functioning and alertness. So even if you do not have the mental health consequences, people can die with the physical consequences. Somebody who drives while under the influence of the drug gets into an accident, injures people, kills people, or himself, and things like that. So there is a direct correlation between substance abuse and some other mental illnesses. If you pick depression, which we have spoken about for a bit, some people start abusing drugs because they feel bad, and they are looking for something to make them feel good. They are looking for something to lift their mood. But you don't solve a problem by creating another problem.
I don't think they go into it thinking they're trying to create another problem. I think
no, they don't. They don't. It is part of the fallout of asking for solutions in the wrong places. If I feel bad and I don't go to my doctor and I go to somebody else who says, if you smoke this thing, you'll feel good, and then it goes from 1 drug to 2 drugs to 3 drugs and things like that, and other complications set in. So you have that direct correlation. Suicide, which we're also talking about, is also strongly correlated with substance abuse. Okay, and I like the fact that you mentioned that the gap between males and females, particularly in young people, has closed. There's many. It used to be a problem with boys,
yes.
But now both boys and girls are about at par when it comes to substance abuse across all the substances, really. So it's a big problem.
Okay, so how can we amplify the advocacy for help so that parents listening to us can also understand that they can get help, and these are the little telltale signs to look out for?
So again, we are talking about it. That is part of the awareness. What are the warning signs? You notice a behavior in somebody, you notice a change in behavior in a young person. What are some of these changes in behavior? Disappearing acts, money problems. They stole my phone, urgent 2K, my computer is bad. Somebody always getting into problem. And before we round up, another big problem that is related with drug abuse are the loan apps. Because when people start using drugs and start getting into money problems, they then resort to loan apps and borrow money. Before you know it, you have an unemployed person or somebody with a very basic level job, indebted to the tune of millions. And what is he doing with the money? Is funding the drug use. There's a drug that when people take, their tongues become blue. Unfortunately, we also have a very harmless sweet that makes the tongue blue, so they can pretend that that's what they took. There are drugs that when people take, their eyes become red. There are people who inject themselves and then you see that their cloth is stained, has a blood stain. They always have an excuse. Oh, the door scratched my hand. Oh, something happened. There's always an excuse for an accident to explain how they look. So some of these changes are the things that people will notice and suspect that this person may have a drug use problem. Change in behavior, irritable behavior, unusual, irrational act are some of the things that will make you suspect it.
Okay, then we'll see the final question. What kind of interventions would you want to see the government do? You know, we have several interventions, and I'm happy you mentioned the Lunacy Act and how many years it had taken to get that reform just this year, which is over how many years? 40, 50 something years ago. So what kind of interventions would you expect moving forward that you'll expect Nigerian government to put in place to address mental health issues?
Human resources. We need doctors, nurses, psychologists, occupational therapists, all cadre of health workers that provide service, mental health services. We are bleeding through emigration of our professionals. We need to stem that tide quickly. We need to produce more people. We need to bridge that treatment gap, make services available in our rural areas. And we have a very wonderful plan for that. We haven't just implemented it properly, because our mental health service is supposed to be incorporated into primary health care. So people should be able to go to a PHC near them and access mental health services. But again, you need human resources for that. Training, retraining, public enlightenment, and we need to address the supply end of it. NDLEA, they are doing a great job. But you see, the drug cartel, it's a very big criminal organization around the world. We must all cooperate with the NDLEA. If you see something suspicious, please report. Because if you do not cut the supply, you do not know where it will end. You do not know who will use it, who the victim will be, and all that. So we take care of it on the demand side, we take care of it on the supply side, and then we enlighten the public.
Dr. Olusegun Soyombo, consultant psychiatrist, National Hospital, Abuja. Many thanks for being our guest this morning.
Thank you for having me.
It's been very, very enlightening. Yes.
Thank you.